on this episode of The Natural Plastic Surgeon. So the max that we can take out during any one time is 5 liters in an outpatient setting. Anything more than that, we have to go in a hospital. And I don't like to do that because hospitals have a lot of bad bacteria that can kind of sneak into your wound. So I don't like to bring you to a hospital to try to do more. What I think we instead try to do is let's focus on 5 liters worth of an area, make that look good, and we can come back for additional areas if we need to. And a lot of people are skinny, and 5 liters will never make it to 5 liters. And so those skinnier people we have to be more careful about because they can get much more dehydrated versus their whole body size. Everybody, it's Dr. Barrett, and we are on episode 32 of The Natural Plastic Surgeon. We are going to get super focused on liposuction. We're going to tell you everything you need to know about liposuction. All right, there's different areas, different techniques, different cannulas. So we're just going to take a deep dive into it so that you can leave this kind of having a lot of your answers, a lot of your questions answered, and really kind of fully understand what it can and can't do. So let's dive in. So stay tuned. All right, stay focused here. We're going to go pretty quick. What is liposuction? Liposuction is basically removing fat from somebody's body, typically using suction to do so. All right, that's it in a nutshell. There's different varieties of liposuction. You can do power-assisted liposuction, which is a mechanical machine that vibrates the cannulas back and forth to help break up the fat as you remove it. You can get laser-assisted liposuction that actually burns. There's like a laser beam on the end of a cannula. This is a typical cannula that I'm holding in my hand right here, and it has a laser beam on the end of it that kind of burns and coagulates things at the end. You could get ultrasound-assisted liposuction that vibrates it at ultrasound frequencies, super, super high vibration rate. Or you could just do straight on hand liposuction where you go in with the cannula with your hand back and forth, back and forth, back and forth, and delicately remove the fat. That's it in a nutshell. It was basically created this past century in the 1900s when people were able to try to do some spot reduction, but they were very much limited in terms of how much fat they can remove at a given time. So what they came up with was pre-injecting a solution to make it safer, because the problems with it is if you did liposuction on an area, you would get a lot of bleeding. And if you did multiple areas, people would actually die. So liposuction, when it was first created, was very risky and very dangerous. So when someone came out with what's called tumescent solution liposuction, which means they inject a solution that constricts the blood vessels prior to you doing the liposuction, it became much more safe. In fact, it's actually the #1 common procedure in the United States done every year. And it's a great way to remove fat in stubborn areas. It's not a great way for weight loss. So I get a lot of people that ask me, can I do liposuction to help me lose weight? No, not really. It's not really a great thing because we're really limited to 5 liters of fat that we can take off from an individual at any given time in an outpatient setting. Anything more than that, you want to be in a hospital. Now, there's some people that go for that. I just don't think that's a healthy thing to do to your body, to kind of physically and mechanically remove the fat. Liposuction, in my opinion, is great for sculpting. It's great for combination of other procedures, and it's great for taking care of stubborn areas of fat. The most common areas that I perform liposuction are on the neck. This is a home run area, you guys. It always works well, and it helps contour the whole neck. You get a better cervical mental angle. That's the side view of your neck going from your chin down to your collarbone. And it also tightens up your jawline if you kind of cheat a little bit up onto the jowling area with very minimal risks. The next most common area that I do liposuction are the abdomen and the flanks. And used in combination with fat grafting, you can take this fat and build a bigger butt or more fuller breasts. All right, so I do liposuction on the abdomen and flanks, the next most common. For men, I also do it on the chest. For women, for breast reduction, I do it on the lateral side. There's also little boutique areas like the area right above the breast or bra line fat rolls. The back can be done, although it's super painful. There's a lot of thick back skin, so the gains from doing upper back lipo are not very impressive. They can get rid of really stubborn fat deposits there. A few weeks ago, I did a buffalo hump reduction. This is someone who had a hump on the posterior part of her neck. I did some liposuction there. Arms are always a very common thing that we do, help sculpt the arms as well. Inner thighs are a home run most of the time. If you have a lot of loose skin there, you want to combine it with a radiofrequency skin tightening at the same time so that you don't get lax skin on the inner thighs. Saddlebags are another common area, and overall thigh reduction is very popular. We can go down into the ankles, into the calves. Again, we start to getting into diminishing returns when it comes to doing liposuction in these areas, mainly because there's substantial swelling that happens once you go below the knee. So I try not to go down there unless they're pretty severe situations. Okay. Now, if you have cankles, you have no other way to get rid of them, liposuction can help you down there, but you just have to be okay with a lot of swelling that can happen. Now, if you do decide to do below knee liposuction, you got to make sure you go to a board certified plastic surgeon. There's a lot of people out there that try to do liposuction in this area and they end up with compartment syndrome in the lower part of the leg. Okay, so this is a very tricky area. The very safe and reliable areas are the abdomen, flanks, inner thighs. Going below the knee is dangerous. Going to the arms, it can be slightly dangerous. Going to the back is just painful, and results are kind of minimally achieved there. Where are some other areas that people get liposuction? Well, you could do parts of the face. I don't recommend that. There's a lot of facial nerves there. And then I've had some people get liposuction of their buttocks themselves, but most of the time people want more fuller buttocks versus smaller buttocks. I did get one woman who had an amazing BBL result, so much so that it was just like a shelf, and she ended up getting, we ended up doing liposuction just to take her result down. I didn't do her original operation, but I was able to kind of tone it down a little bit to more to her liking. Okay, so that is liposuction. It basically uses suction to suck out the fat. And every time you pass a cannula, you go by a little fat globule, and the cannula picks out that little fat globule and it sucks it in. Okay, so it creates that negative suction. So and that's a really key thing, because you're not going in with sharp cannulas, you're going in with blunt cannulas that kind of suck the fat in, because the fat is very delicate and it can move, versus blood vessels and other things, they kind of stay permanent and it doesn't suck those things in, which can cause bigger damage, especially with nerves and so forth. Who is a good candidate for liposuction? Well, we talked about that briefly. Someone who's a good candidate for liposuction is someone who maintains a normal diet and healthy lifestyle, someone who has kind of reached a goal weight, but they have stubborn areas. If you have a lot of loose skin, liposuction may not be the answer for you. Okay, so loose skin, liposuction removes fat. It doesn't help with loose skin. It can actually make loose skin worse. So I get a lot of people that need a tummy tuck. They come in. I had a person today. She's like, I lost 50 pounds and I have a stubborn area on my abdomen. She was otherwise skinny, but it wasn't fat that was her main issue. It was loose skin. So I recommended a tummy tuck. And in fact, I said, no, I can't just do liposuction. It's going to make it worse for you. So we see that most commonly on the inner thighs and on the abdomen, the front part. The areas that are home run, easy to do areas that have substantial results no matter what your skin laxity are the flanks. They almost always retract back like shrink wrap whenever you do it. That's why I'm super aggressive on the sides versus the front. The abdomen, it's kind of a flexing area. It doesn't really do well if you over resect, okay? Mainly because that extra skin. What are the benefits of liposuction? Well, you look great. And depending on what type of liposuction you do, you can do high definition liposuction to kind of help sculpt abs, sculpt the waistline, help create an appearance of a buttock augmentation, even though you don't do a buttock augmentation. And it really just helps get rid of those stubborn areas and give you a much more hourglass figure depending on what you're trying to do, or highlight underlying musculature in the case of like distinct areas like the arms or the neck or the inner thighs. The neck is one of my favorites because it really helps honestly take age off people when you do it. So it has a combined effect of making you look sexier and younger at the same time. Let's dive into the different types of liposuction. There's laser, vaser, okay, or smart lipo. Let's start with the laser assisted or the laser liposuction. It's called Smart Lipo, and is one of the companies that do it, and it has a laser beam on the end of the cannula. The proposed advantages of this are that the laser beam help tighten the skin and connective tissues underneath the areas at which you do the liposuction. Unfortunately, I have not seen the literature or the studies that have backed up the improvement of laser lipo over regular lipo. to the point where I can see a noticeable difference between the two. That's why I don't do laser lipo, because when you put a laser beam on top of the end of a pokey stick, you can have bad problems happen. You can have burning, and you can have unintended consequences of things burning from the tip of the laser hitting some vital structure. Until I see those results look better than standard lipo, I'm not really willing to switch. And I get a lot of reps that come to my office. Oh, you got to buy the smart lipo. It's going to change your practice. It's going to change your results. Well, guess what? I get the same results with just regular power assisted liposuction than that people are doing compared to laser lipo. I don't see any advantage of passing a laser beam underneath your skin. Prove me wrong, please. I'm happy to use a product that's better, but right now there's no studies that really have shown that it actually works better than regular liposuction. There's also ultrasound assisted liposuction. This is kind of cool. It helps break up the fat. I think this is more of like an easier product to use for surgeons. It's also great in cases of revision lipo that can really get to difficult areas. And it just makes, I think, liposuction a little bit easier. I don't use it typically because I don't want to have the risk of the ultrasound creating a burn, a thermal injury. So I stick to standard liposuction, and I just work a little bit harder when I get to those difficult revision cases that I have to work through. I do use micro air power assisted liposuction, and I have the machine is actually sitting right next to me here in the operating room. And that helps me kind of vibrate the cannula tip to kind of break up scar tissue or break up difficult areas of fat so that I can remove it. To me, that's enough. Some other surgeons may want to use ultrasound, and I think that's great. They just have to be very careful with the amount of vibration that happens with ultrasound. You can get thermal injury and burns, especially at access sites. Now, when it comes to traditional liposuction, I do what's called safe lipo technique. And Dr. Simeon Walls kind of came up with this technique where you go in and you break up the fat first. I use exploded tip cannulas. I break up the fat. So it's like basically doing liposuction twice. I go in no suction, break up the fat in a deeper layer so that the fat is just kind of loose and morselized with the regular liposuction that I do. And then I go back in with very small cannulas, about the size of 3 millimeters, and I go and I actually gently remove the fat once it's on. Then I do it on suction. The advantage of this is it doesn't go after and it doesn't like scar the skin down. One of the biggest risks of liposuction is you get too close to the skin, you create an injury in the skin, and then it tethers down to the underlying fascia. So there's actually been a lot of botched liposuction pictures out there. If you Google botched liposuction, you can see examples of horrible looking results. And that's mainly because of contour irregularities. It's either over resection or someone who's going way too fast using cannulas that are way too long and creating contour irregularity. It's almost better to not do liposuction. It is better to not do liposuction than to do liposuction and end up with a contour irregularity, because people will notice it a mile away. They'll be like, what happened to you? All right. That's not what you want when you want to come in and you just get regular liposuction. Okay. And you just want to try to reduce a spotted area. You have to take your time. It takes a lot of meticulous patience and attention to detail to do it right. And you want a surgeon that really does it. A lot of people think that liposuction is easy. You have a lot of family practice doctors that take a weekend liposuction course and they think they can do liposuction. Well, what happens if you poke an artery or you poke a nerve or something like that inside? You really don't know what to do if you're not a real surgeon. So be very careful. Make sure that if you are considering doing liposuction, go to a board certified plastic surgeon. It makes a big difference in terms of quality of results and the safety of your operation. Remember, you're completely asleep. You have no control over that entire operation, and you have to completely trust your surgeon or your doctor. But I would make sure they're a surgeon, especially a board certified plastic surgeon. It takes a lot to get there, okay? And it takes a full understanding of anatomy and demonstration of safety practices to get that board certification, so look for it. So what are cannulas? Well, cannulas are the little instruments that we use. I have two in my hands here. You can hear it for you guys on the podcast. They have different tips on them and they're different sizes. And so when we do breaking up of the fat, we use what's called an exploded or basket tip cannula. And then when we're going to remove the fat, we use just straight up Mercedes cannulas that are a low profile design. They're just getting the low hanging fruit. They're not going after skin. They're not going after nerves or anything else. And so we use these large sizes to kind of break up the fat. And then we come in with these smaller sizes delicately to remove the fat. They're blunt tipped. You'd never want to use a sharp tip cannula because that can poke holes into your abdominal wall and into your organs. There's a lot of horror stories out there of people using sharp tipped cannulas and getting abdominal organ perforation. You don't want that. You want to use very blunt, because even if this were to poke into something, it's not going to cause a laceration or major bleeding if it were into the wrong place. Cannulas come in all different kinds of shapes and sizes. There's some that have unidirectional siding on it. If I just want to do a spot reduction on both the deep layer or the superficial layer, I have that control. Or we just have regular well-rounded ones. We have spatulated cannulas for the neck that look like a duckbill platypus. You go in and they kind of scoop out all the fat in a nice horizontal manner. The key is to kind of go with somebody who knows exactly which cannulas to use and keep them on the smaller side. Someone that's using cannulas that are bigger than 4 millimeters in size are being way too aggressive. I've never had a patient where I've had to use greater than 4 millimeter cannulas to remove fat. I don't care how big you are. You're just risking significant injury if you're going 5 millimeter cannulas or bigger. So some of the techniques that I also do during an operation is I create multiple access sites. I hide my access sites in discrete locations, and the access sites I do use, they're close enough to each other where I can do cross-hatching, okay? So cross-hatching is basically a grid work. So if you were to just use one access site on a liposuction patient, you would go in and you would create lots of little grooves in one horizontal plane. You would have no way to prevent little segmented grooves happening in the skin afterwards. So that's why I do what's called cross-hatching, and we go horizontal to that initial plane. So imagine you go, it's like mowing the lawn. You know, you go up and down and up and down, and you can see those lines. Well, if you kind of go over it horizontal, you've kind of evened everything out. So that's kind of the thought about cross-hatching, is that you get a much more even reduction and you avoid contour irregularities from grooving from single site access. All right, so we always use multiple access sites. The more the better. It gives us more angles at the fat. Yes, you'll have additional dots, but we like to use port protectors that help protect the skin in heavy areas that we do the liposuction, because what we found is that when the skin gets beat up from where the cannulas go in and out 1,000 times over and over and over and over again, we found that the plastic ports actually protect the skin from that, and they heal up much nicer. So those are little added tips you want to make sure that your plastic surgeon does for your operation. And we also lubricant so that the skin doesn't heat up as well, so that it heals nicer. What steps should I take before surgery? Well, you really want to be as close to your goal weight as possible. Diet and exercise are key. Intermittent fasting. Again, this is not a weight loss procedure, right? We're here to kind of take care of stubborn areas, make you look good, help you with some form. When it comes to men, I really like the high definition liposuction, and same with women, where we can create like abdominal grooves, highlight underlying musculatures that you've been working hard for, but you just can't visualize because you have just a little bit too much fat in that particular area. Is liposuction permanent? Yes and no. Your results are very much permanent. And what we found recently is that fat does regrow slowly over time, but it takes about 10 years. So for all intents and purposes, and even when it does regrow after 10 years, it doesn't come back nearly as robust as when it was prior to liposuction. So for all intents and purposes, it is permanent, meaning you pretty much don't have to do anything else afterwards. Now, if you gain a bunch of weight afterwards, you can regrow fat in that area. Most likely you'll regrow fat in other areas. So my recommendation is, if you're going to plan to have liposuction, be at a goal weight and don't gain weight afterwards, okay? Your fat won't regrow. So let's say if we do liposuction of your abdomen and your flanks, and we get that fat reduced, and then you gain a bunch of weight, it won't come to the abdomen and flanks as much as it would come to other areas that have been untapped. So there is a slight distribution irregularity that starts to happen if you gain a ton of weight after liposuction. So my recommendation is, get your goal weight and stay there. Downtime after liposuction. It varies. If we do full body liposuction, you're out for 2 weeks. If we just do a spot, little focal area like the neck, it's only 3 days of downtime. So it really just depends. And one of the biggest things is to stay hydrated. Your body has a lot of third spacing of fluids after your procedure. And so you can get dehydrated and you don't really know it because your body still has anesthesia in your system. So the max that we can take out during any one time is 5 liters in an outpatient setting. Anything more than that, we have to go in a hospital. And I don't like to do that because hospitals have a lot of bad bacteria that can kind of sneak into your wound. So I don't like to bring you to a hospital to try to do more. What I think we instead try to do is let's focus on 5 liters worth of an area, make that look good, and we can come back for additional areas if we need to. Now, a lot of people are skinny, and 5 liters will never make it to 5 liters. And so those skinnier people we have to be more careful about because they can get much more dehydrated versus their whole body size. So if we do your whole entire body, that might be 4 liters, but if you're skinny enough, that's still a big impact on your body, okay? Versus someone who might be much heavier can easily just do 5 liters in the abdomen and flanks alone. Again, that 5 liter mark is kind of relative. It's a safety mark, but if you're skinny, it's something you need to talk to your surgeon about in terms of recovery. If you are going to get full body liposuction, I do recommend you stay in an aftercare facility for that first night, just to make sure that your vitals are monitored and you have adequate hydration and someone to help you out with your medications and so forth. Is it painful? It kind of is. It's a little bit painful, guys. There's a lot of numbing medicine. I don't like to do this under local. It can be done under local. Generally speaking, when people are getting liposuction done under local, it means they're using facilities that are not fully accredited because they can't have an anesthesiologist and they're not licensed to do so. So my recommendation is to go to a board certified plastic surgeon and a fully accredited surgery center that has a great safety record, something you want to verify before you go. It can be done under local, but I met a lot of people that do it under local. They do it in the doctor's office and they regret it immediately. You're there on the table, you paid all this money and it hurts like hell and there's nothing you can do about it. Don't put yourself in that situation. In my opinion, just have an anesthesia, pay a little bit extra for an anesthesiologist, go nice and comfortably asleep, wake up and it's all done. That way your surgeon can focus on the operation. You don't run the risk of too much tumescent solution creating cardiac arrhythmias. A lot of people forget that. A lot of people think that local is safer. It's not necessarily safer. If you're using so much lidocaine to numb the area, that can create cardiac problems. Okay, so try to stay away from getting this done under local. If I were you, and I've done it both ways, I think the safest way to do it is with the help of an anesthesiologist who can watch your vitals and watch the operation, and then the surgeon can focus on getting the excellent reduction that they need to do, and your pain is well controlled the entire time. And you wake up and it's done. There's no traumatic experience, okay? I've never met somebody who's had liposuction done under local and said, wow, that was fantastic. Never. All right. So use an anesthesiologist. They know what they're doing. Can I get liposuction at the same time as other cosmetic procedures? Absolutely. We do this all the time, especially with mommy makeovers, with tummy tucks. It's a useful tool with scar improvement, facial fat grafting. We can use really small cannulas. I mean, if you think these cannulas are small that I have in my hand, this is a 3mm cannula for all your listeners out there. They actually make them way smaller. We can actually take out micro droplets of fat, use it for areas like under eyes, for lips, for cheeks, slightly bigger we can do for breasts, and then we have buttock augmentation. Sometimes men, we can do chest augmentation or bicep or deltoid augmentation, which is really cool. It's really powerful. So yes, the answer is yes, liposuction can be done as the same time as another cosmetic procedure. And, you know, it's a great time. You're already under, you might as well add on an area, whether your arms, your chin, your neck, whatever it is that kind of bothers you. I have a lot of people that ask me about cool sculpting and other options besides liposuction, and things like cool sculpting work. Cool sculpting is when it's cryotherapy basically on your skin, and they found this out by kids who had, like, they would suck on popsicles and it would freeze one side of their cheek and that would be thinner over time, or horse riders that would ride outside in the cold weather, their lateral thighs, they would get a reduction because it was constantly cold all the time. So yes, it does work. It's a spot reduction. It's kind of not as controlled as liposuction. So sometimes you can get a shark bite type of effect where you get a divot, a scallop divot. But if you're adamantly opposed to getting surgery, or you're not a surgical candidate, it can work for spot reduction. Now, it's expensive. It's kind of painful when they do it, and it takes 4 to 5 treatments to see results. If you're like me, I don't have the patience for that. So I would say just go get some liposuction, get it done appropriately. They can do a better job. They can contour everything. You're one and you're done. It's probably less expensive over time versus a minimally invasive thing like cool sculpting or thermage or any of these other ones that are kind of spot reduction. Do we have these things in our office? Yes, we do. But I much prefer, I'm a surgeon. I can see exactly where we're taking out the fat. I would much rather do liposuction. Now, a lot of people are worried about anesthesia and the risks associated with that. But the chances of something bad happening to you under anesthesia, if you are ASA category 1, meaning you're healthy, are pretty rare. It's like you're more likely to be struck by lightning in your lifetime than to have something bad happen to you from anesthesia. Everything has risks, including the minimally invasive stuff, such as cool sculpting or thermage or some of the other laser assisted devices. One more thing about liposuction is you do get a skin tightening effect from the liposuction. It's about 30%. Ultimately, it's not what you take with liposuction. It's what you leave behind. So you get a lot of aggressive gunners out there that are trying to take all your fat, but that just leaves you predisposed to getting contour irregularity. So you want somebody that has a lot of experience. It's not going to be too aggressive, knows exactly what they're doing, knows how to leave the appropriate amount of fat behind to give you that beautiful result that you're looking for. That's it, you guys. I'm done with the podcast about liposuction. We do have more information on our website, drdanielbarrett.com. Check it out. Thank you guys for tuning in. End of season 1. Thank you.